when you realize that people exist in these niches geographically, which is a human thing to do, any diseases that are occurring more commonly in those populations become the group of people that you can start to interact with, not only on the personal level and say, how do we talk about the fact that you have an increased rate of this disease in your community without stigmatizing your community, because that is a sensitive issue. But you also have people where you can offer genetic testing for that community and identify the people at risk, the few percent who may be at risk, and get them into therapeutic approaches that may be experimental new genetic approaches, or even just good healthcare. They're at risk of some sort of skin condition, and you want to make sure they see a good dermatologist. And this is also something which is really important in terms of the perception of rare diseases, because what's rare globally may be common locally. And if you can identify this, it has major opportunities for being able to take an observation that you make in one or two families in that community and offering it to the broader group as a whole.
Yeah.
The one group that we're working with actively at the moment is a population called the Garifuna, who are just a delight to work with. I'm actually wearing a Garifuna wristband. I realize it's the colors of their flag. The Garifuna started off on the island of St. Vincent in the Lesser Antilles, just west of Barbados, as a community of indigenous Arawak and Caribs. They basically brought onto the island freed enslaved black people from the other surrounding islands, formed a community with them between the 1500s and the 1700s. And then the British decided they were going to take over the island, decided they were going to get rid of the black Caribs, as they call them, killed most of what was probably tens of thousands of individuals, and took the remaining 2,500, 3,000 individuals and dumped them on the coast of Central America, mostly in Honduras and Belize, but to some extent Guatemala, where they formed a thriving community again. But now you have a founder population of a small number of people who underwent a bottleneck because of genocide, basically, grew again as a population, and then started to immigrate to the United States in the 20th century. And there are 200,000 Garifuna, apparently, in the Bronx, around the Crotona Park area in the central Bronx. When my wonderful colleague, who's a population geneticist, Sri Lakshmi Raj, studied the genomes of New York City in a paper she published about a year ago, she found that the Garifuna community, 5% of them are walking around with a genetic variant that causes hypertrophic cardiomyopathy. It's a variant in a gene called MYBPC3. We are now in a situation where we've built trust, which has to be earned. The Garifuna community are spreading the word, saying, if you know that somebody in your family died of heart failure in their 50s or 60s, or just a sudden cardiac event because you may have a rhythm problem that occurred in your uncle or your grandfather or mother, then go and get testing. Because if we can find that that you have this particular type of hypertrophic cardiomyopathy, there is an existing drug. There's a cardiac myosin ATPase inhibitor that we can give. Yeah. So you have a little bit of thickening, you know you're on the trajectory to have your heart go downhill like that, we can ameliorate it. We can give you possibly a normal, healthy lifespan.
Yeah, no, and that's an amazing example, because you're right. We now have drugs to treat hypertrophic cardiomyopathy in a way that we couldn't 10 years ago. And a lot of times it is these rarer mutations and causes of diseases, and there's something available once you know what you're dealing with, and you can really offer something to improve their lives or extend their lives.
And just on that point, there are 200,000 Garifuna in the Bronx. 5% of them have this variant. That's 10,000 people.
Yeah.
That is no longer a rare disease. That's a rare disease globally, that's common locally.
Yeah. That's such a heartwarming example. You can make a difference in those patients' lives.